There are several different types of blood cancer, and while some can be curable, others, like multiple myeloma, are not. It is a life-threatening blood cancer that affects nearly 250,000 people globally. Now, in 2013, there were an estimated 95,000 people living with this condition in the U.S. Now, while the facts behind the disease may seem troubling, leaps of progress have been made. Since September is Blood Cancer Awareness Month, we are taking a moment to talk to Dr. Kenneth Shane about the advances we are seeing when it comes to this cancer over the past decade. Doctor, thank you so much for being with us. I actually kind of want to start out by getting some education on multiple myeloma and what it is.
Sure thing. So multiple myeloma is, as you said, it's a blood cancer. It's a rare disorder of the bone marrow, or cancer of the bone marrow. We see it's a very complicated disorder. It's something we see more often in patients that are over the age of 65. The majority of patients are over 65. Men a little bit more likely than women, and African Americans have a higher rate as well. It's a complicated disorder, one that's defined by having we call symptoms. And these symptoms can involve things that are pretty important. One is fragile bones, so they can break and fracture. Kidney failure, might need dialysis. Could also drop in your counts, your blood count, so your white cells and your red cells, part of your immune system, leading to infections. And also elevation of something called your calcium, and it can cause all kinds of havoc when that's elevated in your blood as well. So you can imagine this is an important thing for us to recognize and continue to develop new strategies and new therapies or medicines to combat this and control disease for long periods of time for our patients to have improved outcomes.
And, you know, I did say at the beginning that these things that we're going to talk about, like the symptoms, are very troubling. But there have been those, progressions that we have been seeing in the treatment. Where have we gone from a decade ago till now?
I think it's really important to highlight this, and again, to bring awareness to the fact that we've come a long way in the treatment of our myeloma patients, and to a point where we can control disease very, very well with, again, drugs that are very successful and can allow patients to carry out activities of neuronormalcy as they go along, because these are therapies that patients are going to be on for long periods of time. We have to recognize it's important to balance the efficacy, meaning the success of controlling disease, as well as maintaining a good life for a patient at this point in time.
What can we really kind of contribute to these advances that we're talking about? Is there anything that kind of stands out?
I think absolutely. I think, central to all of this success is really multifocal, but really research. And research can be lab research, translational research, and then patients and caregivers participate in clinical trials. But all of that is how we've learned about the biology of the myeloma cell, the bad guys. How can we identify how they grow, how they proliferate, meaning double, and how they become resistant to the therapies we have. And so by understanding those mechanisms, we've developed new targeted therapies that attack different aspects of that. And that's really a huge part of the success we've garnered, including the last 18 months. We've had 6 new indications, which means we have 6 new drugs or drug combinations approved by the FDA in the United States for the treatment of multiple myeloma. So as you can see, we're growing, but we need to continue to move forward and have more curative intent therapy in the near future.
Well, then, as a physician, how do you decide what treatment is appropriate for a patient?
Yeah, that's a really important question, and we think about it as a patient sitting across from me in clinic, is that you have to look at the patient itself, the disease and how it presented, the other symptoms that may have come on, the other medical problems the patient may have come in with, and all of those things help us dictate how many drugs when we use in a combination, what drugs might they be, and then what is the sequence of therapy we're going to use afterward to control the disease for as long as we can, to hopefully, again, push back any kind of relapses as far as we can.
Well, Doctor, I know we can only get so much information from you today, and I very much appreciate that. But if somebody wants more information, is there somewhere online that we can go?
Absolutely. And I think what's critical for us as an educated patient and educated caregivers make this all possible. And so I recommend sites that I think about online are the Multiple Myeloma Research Foundation, the MMRF, International Myeloma Foundation, IMF, and then thirdly, the Leukemia Lymphoma Society. These are all great places to have important vetted information, this quality, and other resources as well for myeloma, as well as other blood cancers.
Well, like you said, being educated and knowing what's out there available for you is definitely a high priority. So, Doctor, thank you so much again for being with us.
Thank you for your time. I appreciate it.
Stay with us. We'll be right back.